Hi everyone, I'm Anastasia, your host for Coffee Chat with Anastasia, and I'm so excited that you joined me here. Our next 4 videos are going to share from our live event at Yankee Dental Congress with key opinion leaders. This was brought to us by Crest and Oral-B. It's meant to do 3 things. Number 1, empower the dental hygienist, because we face the same challenges clinically every day. Number 2, it's meant to help us educate our patients in acquiring and maintaining health. And number 3, it's meant to engage. So when you see these videos, if there's a question from a certain KOL that you have, comment. We're all here on this same journey. So together we can take what we learn and make a difference with it. Thank you for joining me.
Her expertise is on dental implant maintenance and regeneration. She has designed so many instruments, published a successful book called Peri-Implant Therapy for the Dental Hygienist, Clinical Guide to Disease and Maintenance Complications. And she's also recently mentored a class from the O'Hare University so she can help dental hygienists get their bachelor's degree. So give it up a warm welcome to Susan Wingrove. Hey, all right. Let's just all do it again. You can't have too many rounds. Cheers. There you go. Cheers. Well, Susan, when I met you in Montana this past summer, which is beautiful, has anybody been to Montana? It's absolutely stunning. And Susan and I were talking because I'm a motorcycle rider and she is a bike rider, and I thought they were the same. It's chemically blonde. We're just going to go with that. So I got to asking her some more questions to get to know her a little bit better. And she loves to ride the long-haul trucker. Does anybody know what that is? I didn't either. I had to Google it. So Susan, enlighten us as to what the long-haul trucker is.
It's my little piece of Minnesota that I brought with me to Montana when I moved. It's a Surly bike that has a triple crank, which for those of you who road bikers, anybody, knows that a triple crank will help you get up the hills and mountains better, especially if you have gymnastic knees.
How did you transition from being an English teacher to going into dental hygiene and teaching all of us?
Well, my father was a dentist, and in our area we didn't have the funds, for schooling. So I worked at his dental practice while I was going to college, to supplement, the fees of going to college. And I just fell in love with dentistry. Just loved it. So then I decided to go to school for both. So I went to school for both the dentistry and the English profession to do both.
What else does she do? She decided to design instruments, so she's got the Wingrove titanium implant set, ACE probes, and then Queen of Hearts set to help us all provide better clinical dentistry for our patients. And then you're a best-selling author, and your books are actually to the dentists in D1 and D2, am I correct in saying that?
Yes.
Overseas,
yes,
in different dental schools. And then Susan, you're so passionate about talking about implants, and you're passionate about home care. How about giving us a few tips on that and how we can do better?
Well, because I had this degree that I could do both, I got asked to be a regeneration researcher because I could do the assisting, the hygiene, and write up the protocol and things for that. And so doing that since 1995, it got me very passionate about regeneration. I met researchers, and this project went on for about 5 years, and I learned why implants fail. And as a hygienist, I was all over that. I was like, well, how do we prevent this? I mean, we want our patients, as hygienists, we want something to last for them that we're going to recommend. So I got real passionate about implant surfaces and found out that in 1993, they changed the surfaces to rough and porous instead of smooth. And doing that, we needed new instruments that would go along with that. We now know we need to use titanium on titanium and not leave residue behind. So looking at that, with a research eye for home care, we have the same rough and porous surfaces on our implants. So biofilm is key. And we're the biofilm queens. We know all about biofilm and saliva. And we know the biofilms can be really sticky and hard to get off. And so doing that research led me to Oral-B, the Pro 5000. I found that toothbrush, and I was so excited because I designed a set of titanium implant scalers specific for each implant type, to save us time as hygienists. And Oral-B designed specific tips for the Pro 5000 that get in and around implants, specific for implants, which just was like, wow, this is great. One of the most difficult cases we have, right, is to recommend home care for our overdenture patients. How many of you have overdenture patients with bars? So difficult. They need to be able to clean that, and they need to be able to clean the inside of their overdenture. Specific tips by the Oral-B researchers to go under the bar, inside the locator implants, and be able to use your power brush to go in your overdenture. How great is that? Saves them time, it's effective, gets rid of that really sticky biofilm, and we now know the biofilm is what's really going to make, if we get that daily removed by the patient and by us, that's how we're going to have implants last really long time, long term for the patients.
And I will just point to that. Thank you so much. A lot of information.